So dry is a condition that affects a lot of people, where the eye doesn't produce enough tears to keep it lubricated, or the tears evaporate too quickly off the front surface. Well, there's a number of causes of dry eye. Firstly, it could be the meibomian gland dysfunction is one of them, which is where the oils that you produce that lubricate the eyes are not as oily as they should be. Second could be hormonal changes, especially women as they get to later in life. Screen use, environmental changes, age, medications. There's a number of different things that could cause dry eye. Symptoms are like burning, stinging, watery eyes, sore eyes, red eyes, irritation, grittiness. There's a range of different things, and it affects a lot of people differently. It's not a one size or one symptom fits all. So managing the symptoms themselves, I'd always say taking regular breaks from screens. So something called the 20-20-20 rule. So every 20 minutes, look at something 20 meters away from 20 seconds. What we noticed is when we're staring at screens or anything like that, we're blinking 5 times less than normal. Because we blink less than normal, the tears in the eyes aren't getting refreshed, and it gives them the tears then evaporate off the front surface. Getting over the counter eye drops sometimes helps for people with mild dryness in the eyes. Doing a hot compress is quite a good way to help to relieve some of the, if there is any underlying meibomian gland dysfunction. They're normally ways that people can sort it themselves. If you've done all of these and it's still irritating, that's when it's time to see a specialist and get someone else to have a look at it that could look at more advanced care for you. Depending on the type of dry eye, in practice, we'd look at lubricating the eyes first and foremost, hot compresses, keeping the eyelids clean. And then if that didn't work, there's other things you can do, like meibomian gland expression. You can do IPL therapy, which is laser treatment on the glands to help produce better oils. You can look at daily supplements, omega-3, to help improve your tear quality. They're usually the main treatments, and then it's always evolving. So there are other treatments that are available that we can do, but it all depends on the cause. I'd always suggest, if it is persistent, getting seen by a specialist to have a look at it and then come up with a treatment plan specific for yourself. I always think it's wise to consult a professional or a dry eye specialist if your symptoms are becoming more intense or frequent. You'd want to see if there's any underlying causes, like meibomian gland dysfunction or something similar that was causing it, and then they'd be able to come up with a specialist treatment plan for yourself. You've got to remember that dry eye is a long-term condition. It's not a short-term fix. So working together with a professional as a partnership in the long term is most important.